Are you at risk for heart disease? In this video, we'll discuss the top warning signs that you simply cannot ignore. Heart disease is the leading cause of death worldwide, claiming millions of lives each year. It's often called the silent killer because many people don't realize they have a problem until a catastrophic event occurs. The problem begins when plaque builds up in arteries over time. This buildup narrows the space available for blood flow, which can lead to blockages. And it's not only the risk of death that matters. Heart disease can rob you of energy and the ability to enjoy life. But the good news is that prevention is possible through early detection and lifestyle changes. It can't be stressed enough. Knowing the warning signs of heart disease can make all the difference. So today, we'll explore the top warning signs of heart disease that you simply can't afford to ignore. But before we dig in, can you do us a favor? Click on the thumbs up and help us spread the word about heart disease prevention. And ring the bell to stay up to date with our latest videos. We want to make sure you get the latest info so you can live a long, healthy life. And stick around to find out how to get 2 heart healthy free gifts. We guarantee both you and your heart will love them. Okay, let's get into it. Number 10. Sleep disturbances. Sleep disturbances can be caused by a variety of factors, including the physical symptoms of heart disease, as well as the emotional stress that often accompanies a heart condition. Sleep apnea is a particularly common sleep disturbance associated with heart disease. This condition causes an individual to stop breathing during sleep, leading to reduced oxygen levels and increased stress on the heart. Sleep apnea has been linked to high blood pressure, irregular heart rhythms, and other cardiovascular problems. In addition to sleep apnea, other sleep disturbances associated with heart disease include insomnia, restless leg syndrome, and excessive daytime sleepiness. These conditions can further increase the risk of heart disease and worsen existing heart conditions, especially if combined with the other symptoms we'll discuss next. Number 9. Chest pain or discomfort. Chest pain or discomfort, also known as angina, is another common symptom of heart disease. Angina is typically caused by reduced blood flow to the heart muscle, usually due to a narrowing or blockage in the coronary arteries. This reduced blood flow deprives the heart muscle of the oxygen and nutrients it needs to function properly, which can cause chest pain or discomfort. Other possible causes include inflammation of the heart muscle, abnormal heart rhythms, and heart valve problems. Angina can also be felt in the arms, shoulders, neck, jaw, or back. Although angina is often mistaken for indigestion, it is crucial to seek medical attention if you experience persistent or worsening chest pain or discomfort, as it may be a sign of a more severe heart condition. Risk factors for developing angina include high blood pressure, smoking, obesity, lack of exercise, and a family history of heart disease. Interestingly, chest pain is a symptom that's more likely to occur in men than women, while women are more likely to experience the other symptoms we'll discuss. Number 8. Shortness of breath. Shortness of breath, also known as dyspnea, can be described as difficulty in breathing or feeling out of breath. Dyspnea can occur due to the heart's inability to pump blood efficiently. This condition is caused by a variety of factors, such as high blood pressure, coronary artery disease, and heart valve disorders. Furthermore, when the heart is unable to pump blood effectively, it can also cause a buildup of fluid in the lungs. This is because the heart is unable to pump enough blood to meet the body's demands, which causes pressure to build up in the blood vessels of the lungs. This pressure can force fluid from the blood vessels into the air sacs of the lungs, making it difficult to breathe. This can lead to a sensation of shortness of breath or difficulty in breathing, particularly during physical activity or when lying down. Early detection and treatment can improve outcomes and prevent complications such as heart failure. Number 7. Fatigue. Persistent and unexplained fatigue is a warning sign that should not be ignored. As we discussed, a weakened heart struggles to pump blood effectively, which can leave you feeling constantly tired and lacking energy. Fatigue may be more noticeable during physical activity, but it can also occur at rest. If you find yourself experiencing unusual or persistent fatigue, consult with your healthcare provider. People often ignore signs like this, which is part of the reason why many people don't know they have a problem until a significant event like heart attack. Feeling tired or fatigued from working long hours or after exerting yourself is to be expected. However, if you encounter extreme tiredness without any significant changes in your lifestyle or daily routine, or prolonged fatigue, it's best to schedule an appointment with your doctor. Number 6. Swelling in the legs, ankles, or feet. Swelling, also known as edema, occurs when fluid accumulates in the body's tissues. This can be a sign of heart failure, as a weakened heart is unable to pump blood efficiently, leading to backed up blood in the veins and fluid buildup in the tissues of the extremities. However, this can also occur due to common medications like blood pressure medication. Swelling is often most noticeable in the lower extremities, such as the legs, ankles, or feet. If you notice unexplained swelling or sudden weight gain, consult with your healthcare provider. Before we get into number 5, Heart Disease Code would love to give you a free book, The Surprising Truth About Fat and Cholesterol, plus the first episode of the untold story of heart disease, something that everyone concerned about heart health should watch. Click the link in the description below to claim these free gifts. Okay, let's get back to the list. Number 5. Rapid or irregular heartbeat. A rapid or irregular heartbeat, also known as arrhythmia, can be a warning sign of heart disease. This may manifest as a fluttering sensation in the chest, a racing heartbeat, or a slow and uneven pulse. Some arrhythmias may be harmless, but others can lead to life-threatening complications, such as heart failure or stroke. If you experience an unexplained or persistent change in your heartbeat, consult with your healthcare provider. Number 4. Dizziness or lightheadedness. Feeling dizzy or lightheaded can be a sign of heart disease, particularly if accompanied with other symptoms. This may be due to a drop in blood pressure caused by a weakened heart's inability to pump blood effectively. The heart plays a crucial role in maintaining blood flow to the brain by pumping oxygen-rich blood. If there is an issue with the heart's ability to pump blood efficiently, it can lead to decreased blood flow to the brain, causing dizziness. In some cases, dizziness may also be a side effect of medication used to treat heart disease. Certain blood pressure medications, for example, may cause dizziness or lightheadedness as a side effect, which is why it's always best to approach heart health from a proactive approach, which we cover in our other videos. Number 3. Nausea and indigestion. Although nausea and indigestion can have many causes, they can also be warning signs of heart disease. This is particularly important if these symptoms are accompanied by chest pain or discomfort, shortness of breath, or vomiting. The digestive system requires a consistent blood supply to function correctly. Thus, a weakened blood flow can cause problems. In addition, heart disease can cause an increase in certain hormones, such as adrenaline, that can lead to nausea. These hormones are released when the heart is under stress and can lead to imbalances that may make you feel sick. If you experience persistent or worsening nausea, especially if it's combined with other symptoms, contact a doctor as soon as possible. Number 2. Cold sweats and clammy skin. Breaking out in a cold sweat or experiencing clammy skin for no apparent reason can be a warning sign of heart disease. This may be due to the body's response to an irregular heartbeat or decreased blood flow, because your body is working harder to pump blood through narrowed arteries. Persistent night sweats are a good signal that something's not right in your body, and action is needed. Number 1. Pain in the arms, shoulders, neck, or jaw. Pain in the arms, shoulders, neck, or jaw can be a serious warning sign of heart disease. When the heart experiences a blockage or narrowing of the arteries, it can cause referred pain in the upper body. This pain is often described as a feeling of pressure, heaviness, or tightness, and may be accompanied by other symptoms, such as shortness of breath, nausea, or sweating. Pain in the left arm is the most common symptom of heart attack, but pain in the right arm or both arms can also occur. The pain may be felt in the shoulder, neck, or jaw, and may be intermittent or constant. Women may experience these symptoms differently than men, with less typical symptoms, such as fatigue, nausea, or back pain. It is important to seek medical attention immediately if you experience these symptoms, as they may indicate a heart attack or other serious condition. Delaying treatment can lead to further damage to the heart muscle or even death, so get on it as soon as possible. So, there you have it, the top warning signs of heart disease that you can't ignore. Number 10. Sleep disturbances. Number 9. Chest pain or discomfort. Number 8. Shortness of breath. Number 7. Fatigue. Number 6. Swelling in the legs, ankles, or feet. Number 5. Rapid or irregular heartbeat. Number 4. Dizziness or lightheadedness. Number 3. Nausea and indigestion. Number 2. Cold sweats and clammy skin. Number 1. Pain in the arms, shoulders, neck, or jaw. Recognizing the warning signs of heart disease is the first step towards prevention and early intervention. By paying attention to these warning signs and making necessary lifestyle changes, you can significantly reduce your risk of developing heart disease and improve your overall heart health. Remember, it is always better to be proactive and take control of your health rather than waiting for a severe medical emergency. We really hope you found this video helpful. Leave a comment with any thoughts, questions, or requests for future video topics. And remember to get your 2 free gifts: The Surprising Truth About Fat and Cholesterol, and the first episode of The Untold Story of Heart Disease. Just click the link in the description below to get them. And remember to like this video and click the subscribe button so that you can stay up to date as we release new videos. Thank you so much for watching. We hope you have a happy and heart-healthy day.